Over the last several years, the public conversation around GLP-1 medications has focused almost entirely on the massive numbers. We see people losing 50, 100, even 200 pounds, with the scale plummeting at a speed that feels miraculous. But eventually, the scale stops moving, and millions of patients are waking up with the exact same anxiety. What does life look like when the weight is gone? Do you stay on this dose forever? Can you lower it? Can you stop? The data reveals a harsh reality. Up to 65% of GLP-1 users stop taking the medication within their first year. When they do, the biology takes over. Look at this gray line on the chart, which traces patients who switch to a placebo. The vast majority rapidly regain about 2/3 of the weight they lost. This regain is not a failure of discipline. It is an active biological defense mechanism. Your body's fat cells, adipocytes, push back against long-term weight reduction. They fight to maintain the higher fat mass they previously carried, desperately trying to return the body to its former baseline. Treating obesity like a short-term project that ends at a goal weight ignores that biology entirely. These findings mark a shift in obesity medicine towards the maintenance era, prioritizing how to keep weight off over decades, not just months. To figure out how to counter this biological pushback, researchers designed a massive 2-year scientific test called Surmount-Maintain, recently published in The Lancet. After 60 weeks on Tirzepatide, patients were split into 3 paths. The placebo group regained 28 pounds, losing 15% of progress. The 5 mg group saw only 7% regain, preserving cardiovascular improvements. But patients staying on maximum dose held their weight loss perfectly steady. The most alarming detail from the trial happened quietly in the placebo group. Fully 67% of them eventually needed rescue medication because the hormonal and metabolic drive to regain the weight simply overpowered their behavioral changes. Because the drive to regain fat is biological, the defense must remain biological. Cutting off the medication entirely is the highest risk path for relapse. Staying on these medications indefinitely presents logistical hurdles. Patients often develop needle fatigue or struggle with the storage and travel requirements of weekly injectables. A second major study, Attain-Maintain, tested a practical alternative. Researchers wanted to see if patients could transition off their weekly shots and bridge over to a daily oral pill called orforglipron. Switching from injections to the daily pill allowed patients to maintain roughly 75 to 79% of their original weight loss over the following year, vastly outperforming the placebo group. Science has validated a strategy for lifelong care. Whether continuing the full dose, or safely tapering down, or switching to a daily pill, patients have flexible, evidence-based options to protect their health, as long as they don't abandon treatment entirely. These 2 studies provide the scientific evidence needed to dismantle the myth that weight regain is a failure of willpower. Clinicians increasingly view GLP-1s not as a one-time cure, but as a treatment that holds obesity in remission. When that treatment stops, the underlying disease resumes its course. We already apply this logic to other chronic conditions. When a patient takes a statin and their cholesterol drops to a healthy range, their doctor doesn't take them off the drug. If you stop taking your blood pressure medication, your blood pressure will inevitably spike, because the underlying biology of your hypertension hasn't changed. Obesity operates under the exact same biological rules. It is a chronic disease that requires the continuous, individualized management we already dedicate to heart disease or diabetes. Effective obesity care no longer stops when a scale reaches a goal weight. It lasts for exactly as long as the disease does.